tummy tuck or abdominoplasty is another procedure that we perform very frequently in our office, typically 2 a week. They're done under general anesthesia. They take about 2 hours. And they're often combined with other procedures which would qualify as a mummy makeover. So a tummy tuck, what's involved with this is it involves an incision that extends basically from the hip bone to the other hip bone. It's an incision that extends below the natural crease along the pubic area and then up to the other hip bone. And then we make another incision from there to above the belly button. So basically all the skin and fat from the belly button down to the pubic area gets removed. We actually cut around the belly button and leave it where it is, kind of like a flower on a stalk. Then we lift up the remainder skin above the belly button up to the rib cage. And through that we can tighten the muscles, because with pregnancy or massive weight loss, the abdominal wall also gets stretched out. And frequently women will complain of a small pooch in the lower abdomen. And the way we fix this is we actually run a suture, almost like a shoelace or girdle, that runs back and forth through the outside of the muscle, through that tough fascial layer. And that pulls the abdominal wall tight again. And so we have one suture that goes from the upper abdomen down to the belly button, and then another one from the belly button down to the pubis. And so this, with both those suture lines, we can tighten up the abdomen. Once we've tightened up the abdomen, then we pull the remaining skin down to the pubis and close it all with dissolving sutures. We bring the belly button out through a new hole. So it's the same belly button, same place, just through a new hole. So we finish off with liposuction out on the flanks, which further enhances an hourglass figure. I do put drains in, and the reason we do this is because once we've lifted up that skin, there's a space underneath it, and the body likes to fill spaces with fluid. So by putting those drains in, it collapses that space and helps things heal up quicker. I'll often put in quilting sutures at the same time, which help collapse that space, and the drains can be removed even quicker. The procedure takes about 2 hours, 2.5 hours max. Recovery is another hour or two in our office, in our separate recovery room. I like to see patients back the next day. The drains stay in usually 5 to 7 days. The sutures, again, are dissolving, so there's no sutures to come out. Recovery is about 2 weeks, so most people, I recommend taking at least 2 weeks off of work. Full recovery is going to be 6 months. I think you'll continue to have little aches and pains and tightness and swelling up to 6 months afterwards. Full activity after about 2 months. It's a very satisfying procedure. The scar typically fades to a white line after 6 months to a year. A very gratifying procedure, and it has helped a lot of women regain that figure that they once had before pregnancy.